Good evening, everyone, and thank you for joining us for this virtual town hall meeting. My name is Brad Draken, and I'm the mayor of Zumbrota, Minnesota, and it's an honor for me to act as your moderator tonight. And I thought I'd start by sharing one piece of good news. Our world-famous covered bridge that was damaged in February was repaired and finally got repainted a couple of weeks ago. So if you get a chance, please go to the city's Facebook page and see pictures of our beautiful bridge that we're so happy has come back to its former glory. So we're excited for tonight's event. Before I hand it over to Representative Craig, I'd like to go over the agenda for this evening. Shortly, Congresswoman Craig will provide an update on her work in Congress. Then Nina Arneson, our Goody County Director of Public Health, will give an update on the current situation in Goody County. Following her remarks, I will be asking the questions that you ask below. This town hall has Minnesota rules, which means we will all treat one another with respect. Tough questions are great and welcomed, but obscenity is not allowed and those questions will not be asked. We will save the last 15 minutes for non-coronavirus related questions if there are any. So with that, I will hand it off to Representative Craig to lead us in the Pledge of Allegiance and to give her opening remarks. Representative.
Well, thank you so much, Mayor. It is a real honor to be back in our 17th town hall here this evening. As you say, we always start our town halls with the Pledge of Allegiance. So I am with you from Washington, D.C. tonight in my office in the House Longworth building, and I'd like to lead us into the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you so much, Mayor, for volunteering or being recruited, I'm not sure which one, to serve as our moderator this evening. And I want to say thank you to both Nina and your colleague, Vicki, who'll be joining us for this conversation this evening. I'm going to start with some opening remarks, and then we will move into Q&A as we normally do. And as the mayor said, we'll leave the last 15 minutes if there are questions unrelated to COVID-19. So here we go. I always start by thanking our veterans out there who served. When I have in-person town halls, I always ask those veterans if they're able to stand and let us honor them. This is particularly poignant and on my mind as yesterday, obviously, it was a very different Memorial Day in Minnesota and throughout the country, but I especially want to honor those veterans who gave the ultimate sacrifice for this country so that we can come together and be in community and have and live in a country that thrives with its democracy and diversity. So this week we are back in Washington. That means we've got some legislation that we'll be voting on here. But before we do anything with respect to what I've been working on the last little bit, I just want to pause and thank once again our frontline healthcare workers, our police officers, our fire departments, our emergency medical staff, the doctors and nurses who have been on the front line of this public health crisis. You know, I recently also had the opportunity to visit the Postal Service in Burnsville, and I want to say thank you to those letter carriers and those Postal Service employees. And I want to say thank you to the truck drivers who continually get our food supply chain, keep it going and get food to our grocery stores, and in particular those who are coming to work each day in our meat processing facilities and working in our grocery stores. So just thank you to all of the essential workers out there. It really is an honor to have you working on each of our behalves. You know, this is also a solemn moment in the country. We are approaching 100,000 Americans who we have lost in the last several weeks as a result of COVID-19. As of today, we had lost 899 Minnesotans. Today, 2,427 frontline healthcare workers have tested positive for COVID-19 with confirmed cases. So I just want to say thank you to Minnesota for doing your part, for staying safe, for staying home as much as you possibly can. As I said a moment ago, this is my 17th town hall since I was sworn in as a member of Congress. And my focus as we move into these last few weeks has been on making sure that our frontline healthcare workers have what they need, the personal protective equipment, to make sure that we're investing in the vaccines and therapeutic solutions as we work our way through this public health crisis. My focus has been on the supply chain, making sure that we have, or encouraging the administration to develop a strategy, a federal strategy for our supply chain to get personal protective equipment and testing supply components to our cities and our states and our towns. My focus has been on the 350 businesses that my team has been working with. I know that there is tremendous economic stress and anxiety out there because I've been working with and talking to a number of you over the last several weeks. My focus has been on our local mayors and our county commissioners in speaking to you to make sure I understand what you're asking me to advocate for at the federal level to help you get through this public health crisis as well. And I've been focused on our family farmers who, in addition to coming off of a trade war that has lasted a couple of years, are now faced with additional difficulties as many of our turkey growers and our hog farmers deal with the impact of a disrupted food supply chain. I have also observed over the last several weeks, though, the absolute best of our community. I watched as the Open Door stood up a pop-up food shelf, and miles and miles and miles of Minnesotans came through with no questions asked and picked up produce and food that was desperately needed. If you look at people like Bob St. Main, who was a small business owner who contacted my office, and we helped get a Paycheck Protection Program loan in the second round of funding because the big bank had ignored him in the first round of funding, and then last week came out to Egan and paid it back by giving a $5,000 contribution himself to an Egan small business, Wildcats. We have seen amazing community, the Rotarians who gathered in Egan to give blood through the Red Cross, the parents who've balanced work and being a teacher, and the parents who appreciate our teachers even more now that they've had to do both at the same time. Our teachers who are working tirelessly to adapt their lesson plans and the way that they teach and make sure as much as possible that every student has an opportunity to learn, especially those with learning disabilities and IEPs during this period of distance learning. The 350 local businesses that my team is helping right now, it has been humbling to be able to help some of them. It's been devastating to see already some of them start to go out of business, some of them put up for sale. And we're here this week because we're going to make some changes to the Paycheck Protection Program that will allow that program to work better for you. Thank you to all of you who've been putting other people's safety first. It's just been an extraordinary, extraordinary time period to watch so many Minnesotans come together on behalf of their neighbors. And then finally, in my opening remarks, I want to say that, you know, we now have over 38 million Americans who in the last 9+ weeks have filed for unemployment. Over 500,000 Minnesotans over the last several weeks have filed for unemployment. The governor and his cabinet have taken a 10% pay cut for the remainder of the year. It would take an act of Congress to get congressional pay cut. Certainly, if we could get that through in a bill, I would support it. However, I wanted to let you know today that Cheryl and I are absolutely grateful for the health of our family and our 4 boys. And I'm announcing tonight that we will donate a minimum of 25% of my congressional pay to our local communities for the remainder of the year. So starting last month when we contributed to the Open Door and the Jordan Food Shelf. So we're incredibly grateful to be healthy. I'm incredibly grateful to be able to work with so many of you who are in need right now, and for a team that really has worked across this congressional district to do as much as possible to work with every single city and town and county to do whatever we can to be as helpful as possible through these very difficult times. So again, I'm honored to be here in my 17th town hall. I can't wait until we can come back together in person again. I miss you all, even 6 feet apart. And with that, I'll turn it back over to you, Mayor.
At this point, we'll turn it over to Nina Arneson and take her opening remarks. Nina?
Good evening. I'm Nina Arneson, the Director of Goodhue County Health and Human Services. And thank you to Representative Gregg for reaching out for this opportunity to provide an update of COVID-19 from Goodhue County Health and Human Services. And also thank you to the Mayor and all who helped to put this together. I'm here tonight with Vicki Yako, who's our disease prevention and control nurse, who will be able to answer any more specific COVID-19 related questions for us. I'd like to start by sharing about our county's agency's role when it comes to this public health emergency. I will then review some significant milestones of our agency's work, and I will finish with the most current information we have available about the COVID-19 in Goodhue County with a key public health message for today. Our role as a Health and Human Services agency is to promote, strengthen, and protect the health of individuals, families, and communities. And that has not changed with this current public health emergency. We know our county residents, families, businesses, farmers, and communities are hurting. As in our agency, and as public servants, it has been a great honor to respond to COVID-19 public health emergency and to continue to provide much needed safety net services for Goodhue County residents, like social services, food support, and economic assistance. When it comes to our public health emergency response work, our agency started early February by establishing COVID-19 incident management team. And it was about 8 of us, 8 health and human services professionals working together. On March 16, we activated our Incident Command System, ICS, and began implementing our agency COOP plan, Continuity of Operation Plan. We currently have about 26 health and human services professionals involved with our Incident Command System, carrying out various duties, including public information, hotline work, partner coordination, isolation and quarantine essential services, case contact and investigations, and planning and operations. On March 18, here in Goodhue County, our county board closed the public areas of our buildings and declared a peacetime state of emergency in Goodhue County. This put our COOP plans in high gear in order to ensure safety for all, including safety for some of our most vulnerable customers we serve. This also included quickly moving most of our staff to work remotely and have them set up and equipped to provide services via phone, video, email, and mail. This change with the service delivery model was made possible with the support from our county board, our Health and Human Services Board, along with many waivers from human services and public health services from the state and federal levels. That has allowed us much flexibility when it comes to how we deliver services. This actually probably will end up being one of the bright spots whenever we will have a chance to look back and review our work and learn from it and do even better next time. Many of our customers are reporting they are really enjoying the new service model use available technology, we have seen less missed appointments and some operational efficiencies already. On March 30th, in Goodhue County, we opened a local Goodhue County COVID-19 hotline. This is for general questions and support in addition to specific hotlines that state of Minnesota has established. On May 12th, we began helping MDH with case and contact investigation. With the added testing, more individuals were needed to help with this work, and local public health agencies were asked to help along with others. We continue to share, coordinate, and support with community members and partners with resources and information. We're preparing and are ready to provide essential services for community members who are in isolations or quarantine. As we know, on May 18, the governor moved the Minnesota into a next phase of COVID-19, and it's called Stay Safe Minnesota. This does not mean that we are out of the woods yet. Everyone's help is needed. We all need to remember follow the basic safety tips. And we have heard these many, many times, but they are key to our success. Stay home when sick, wash your hands frequently, do not touch your face, stay 6 feet away from others, cover your coughs and sneezes, wear a mask, and did I say not touch your face? Very important. With that, I'd like to review specific Goodhue County data we have available as of today. In Goodhue County, we have 58 lab-confirmed positive cases, and we're expecting more with the added testing. It is also remembered that these are just lab-confirmed cases. Many individuals have not been tested, and many do not show symptoms when they have COVID-19. 21 individuals no longer need isolation. In our county, we have had a total of 5 cases requiring hospitalization. Total 2 cases were admitted to ICU, and 2 cases are currently hospitalized. We're also saddened to report that we have had 3 deaths that have tested positive for COVID-19. These deaths include Goodhue County residents in their 60s, 80s, and 90s. These Goodhue County cases represent the following age ranges. We have had 1 resident 13 or younger, 2 residents between 14 and 19 years old, 13 residents in their 20s, 4 residents in their 30s, 8 residents in their 40s, 10 residents in their 50s, 8 residents in their 60s, 7 residents in their 70s, and 3 residents 80 or older. We currently have 2 cases with unknown age. As when investigations take place, we continuously receive that information from Minnesota Department of Health. Our key message for today is for everybody not to delay important care. All of us need to do our part with COVID-19, with staying safe. We also want to make sure people are still calling 911 for medical emergencies like heart attack and stroke, and not delaying important care. Minnesota hospitals are safe and prepared to treat emergencies and any concerns individuals may have about their health. Finally, I'd like to, I know it is a day after Memorial Day, but I also know that every day is a perfect day to honor and thank brave men and women who gave their lives in service to our country. So thank you for that. I also would like to thank all the past and current service members and all the frontline professionals providing critical services during this emergency. Thank you very much. And if it's possible, I'm thinking we may have a video that with that, it's something now our Goodhue County Health and Human Services professionals put together with the help of community members. And it's just thanking Goodhue County professionals and honoring them and honoring frontline workers doing what they do the best, serving and helping our community. With that, let's watch the video and say thank you to our neighbors, and thank you very much.
Well, thank you both for those opening remarks and for all that helpful insight. But now we're going to move on to the question and answer part of this evening. And one of the perks of being moderator is that I get to ask a couple of the questions first. So for Representative Craig, in that video that we saw showing a lot of our local heroes, we saw a lot of people wearing masks. And I'm wondering, is there something more that we should be doing besides wearing a mask?
Well, thank you, Mayor, and you're absolutely right. Moderator's prerogative. You know, it's been interesting to me because I think what we should be doing is following the advice of our county health and our officials and our scientists and our doctors. And you know what the CDC and all of those are telling us is that I should be wearing a mask if I'm out in public. I'm seeing data come out every single day that indicates a very high percentage of those who have COVID-19 do not have symptoms. They do not know they have it. So me wearing a mask is me trying to keep you safe, just in case I'm carrying the disease, the virus. We also know that, you know, the physical distancing is critically important, and that the more we move around, the more risk that we have to pick up the virus along the way. So, you know, I would say that let's just continue to follow the best advice of the medical professionals and the scientists. And, you know, the truth is the 2,427 frontline healthcare workers who are taking care of COVID patients, who are first responders when someone is sick, you know, they have to go to work. They have to put themselves at risk. But the best and most patriotic thing that we can do is to stay home and to wear a mask when we can't avoid being around other people for the moment.
Thank you. I guess I'd ask the same question of Nina. Is there something more we can do than just wearing a mask?
I think from our perspective, we're hoping that we can keep things pretty simple. Those items that I mentioned when it comes to doing the basic safety measures, when it comes to washing your hands, touching your face, keeping the social distance, and not coming to work or going out when you're sick and seeking help to get tested. Those are just very simple, basic things that all of us can do. And those are the items that will ensure that we'll be able to slow the spread and also not get people unnecessarily sick. Basic things. And I think all of us can do that.
Thank you. I appreciate that. We're starting to get into our first asked questions of the night. And Representative Craig, this question is for you. Bill asks, how can I find out about the status of my stimulus check? I haven't received it yet.
Oh, Bill, I am so sorry. I know that the Treasury has not been able to get all of those stimulus checks out. We have been working with a number of my constituents to check in with Treasury and find out what's going on with your stimulus check. So I know your name is coming up here on the chat. And so my district director, Nick Coe, is on this call this evening, and we will make sure we get your information and follow up specifically. You know, that's really one of the most important aspects of being a member of Congress. It is having a district office full of caseworkers and constituent outreach folks who work hand in hand in our communities, either with our county boards or with each of our mayors across the district, to be able to provide a resource if you have issues with the federal government. Well, you know, during the COVID-19 pandemic, that has been just an incredible service. My team has been terrific at really just following up both with individuals who need assistance, but also with the small business owners, particularly around the district, who were looking for Paycheck Protection Program loans. And so I just wanted to put a little shout out to the district team, because you know what you're doing to help individual Minnesotans and how much you care about each of them and their stories. Thank you for all the work that you've been doing. And then I'll just finish, Mayor, on this note. We've been able to recover over $250,000 that folks should have had from the federal government, things like Social Security benefits or being able to access veterans benefits. Our district office is here to be able to cut through some of the red tape that exists when you're trying to interact with the federal government. So just a plug that, if you know of someone or if you are someone who needs some assistance, that is what our team is here for. You should think about it as, the opportunity to help you cut through red tape from the U.S. government.
Thank you. Nina, the next question for you is from Mark. Mark asks, what is being done to ensure that elders can receive virtual visits in care facilities, receive regular testing, or require adequate staffing levels in those facilities?
Okay. Am I on?
Yeah. Did you get the question, Nina? Otherwise, I'd be happy to repeat it for you.
I think I received the question. From our perspective, one of the good things right now when it comes to emphasizing the work that is taking place with long-term care facilities, and it's part of the governor's battle plan when it comes to ensuring that that is a top priority for the state of Minnesota when it comes to ensuring that individuals in long-term care facilities are receiving care. I am no means an expert on long-term care facilities, but I do know that locally our staff at long-term care facilities are doing everything they can when it comes to ensuring that the patients and residents are there are staying connected. I'm hearing a lot of virtual visits. I'm hearing phone calls. I'm hearing different activities that are done differently in order to keep those residents at their home safely. And trying to see what was the second part of is, I think from a staffing perspective, as most of us know, this is a difficult staffing area. With or without COVID, this has been an area that nationally and in Minnesota, we have struggled when it comes to having adequate workforce. And obviously the COVID is putting additional pressures on this. I believe that long-term care facilities are working with the state and with our regional partners and coalitions and local public health to ensure that individuals would have adequate care and service and reaching out to partners when it comes to when staffing is needed. This is also something that is a priority for the governor, and he's trying to bring everybody together to ensure that staffing would take place. I will check here with Vicki Yako as she's closer to work to the long-term facility and see if she would like to add any additional things to that answer. Do you want to?
Well, I know, like Nina said, it's always a challenge for staffing, and especially when staff are concerned about their safety, and if staff are ill, there's plans for how to move people around in a nursing facility, nurse care facility, so that the people who have COVID can stay together and be assigned only certain staff so that they have enough personal protective equipment and have staffing who are less at risk for complications of COVID. They are doing mass testing at long-term care facilities all over the state right now, facilities that do have outbreaks or have cases, so that they can identify people who are asymptomatic with COVID-19 who might be at work and could be excluded from work, and they can take care of the patients in the facility, the residents also who have COVID.
Well, thank you both. I have another question here, probably back to Representative Craig. Jackie asks, I work for a nonprofit that provides services to individuals with disabilities, several of which are in your district. I'm wondering what support you're offering to home and community-based services in our area and what resources are out there.
Well, it's been challenging, Jackie. Thank you for that question. It's been challenging because a lot of those home-based services are independent businesses, and certainly many of them are small businesses of 500 employees or more, and would qualify for the Paycheck Protection Program should they need access to it. But the broader topic of folks with disabilities has been a top priority of mine. If you remember that in the original CARES Act, the Senate version that was presented to the House defined a dependent as 16 years or younger, excluding 17 and 18-year-olds, excluding 19 to 24-year-olds, who are many of those former college students who are now home living in our basements, eating all the food in our refrigerators, and in particular, excluding adult disabled dependent children. I had a number of parents reach out to me after that was passed. And so that's why I immediately filed legislation to correct it. So the All Dependent Children Count Act was filed. It was included as the description in the HEROES Act, which was passed from the House a week ago on Friday. And in addition to that, on the student side, I have been particularly active to make sure that there was IDEA funding to make sure we can meet our students' IEPs in the CARES Act packages. So again, it's a particularly even more difficult time for folks who have disabled adult children and or students at home who learn different and they're home learning different. And of course, paraprofessionals need to zoom in with them and make sure that they're meeting all of their IEP needs, as well as, of course, special education students. So it's a great question. It's a difficult conversation, but of course, all of the workers who are working with our disabled communities are absolutely essential and valued, and we have to do everything we can in future packages to continue to support them.
Thank you. The next question is for Nina. Leah asks, Wabasha County Sheriff shares that they have had cases where folks have been concerned they may have had COVID and been reluctant to share that information with ambulance services because they're worried the ambulance won't come. Could you address that concern, please?
We're doing musical chairs over here and getting our steps in safely, social distancing. I most certainly would not want to speak for Wabasha County Sheriff. And as I know, the sheriff is a capable professional when it comes to addressing that. But from what our message is that please do not hide the information. This is for your own protection, and this is for protecting those who are serving our community members, and they can take additional protections in consideration when it comes to responding. I'm encouraging when you're seeking help, when you're calling 911, to be open and honest when it comes to sharing that. We will respond. The sheriff's office, 911, our local responders will respond. That's what they have been trained to do, and they'll continue to do that, and they do it every day. So the message really is to be open and honest and call when you need help, and a response will be there.
Thank you. Back to Representative Craig. Siri is wondering what kinds of relief might be coming to the rural parts of the 2nd District. A lot of folks are struggling.
Yeah, I have to tell you, Siri, it's a great question. I serve on the House Committee on Agriculture, and it's been a tough 5 or 6 years for a number of commodities. Frankly, with corn growers and the situation with ethanol, and now we've got pig farmers and turkey growers facing difficulty and kind of coming off a trade war. And so there has been a number of appropriations in each of the CARES packages for this nation's farmers. I think as we think about the food supply chain in this country, it's never been more apparent just how critical the American food supply chain is. And, as we think about, protecting workers who work at these meat processing facilities, I personally believe we need a stronger federal strategy for COVID-19 testing, both on the serological and the metabolic side, to make sure that we're protecting those workers and that we're not disrupting our food supply chain. I think as we think about rural areas, this pandemic has laid bare some of the challenges with investment in rural broadband across this country. As we think about the idea of distance learning, I know I've met families who are still driving to the local McDonald's to pick up internet service. Just like a couple of years ago, I was using the example of my local farmer driving to the local McDonald's to pick up internet services. And I think the Congress has got to react coming out of this, once we get through the rescue phase, to finally make a commitment to make sure that high-speed internet is available across this country. I personally think that one of the lasting impacts of the pandemic is going to be just folks are now getting comfortable with remote or distance healthcare, virtual healthcare. And again, if you don't have access to internet, it's always been hard to farm, especially as the technology has advanced. But you can't do distance learning if you don't have access to high-speed internet. You can't do a virtual doctor's visit if you don't have access to high-speed internet. So I think that is a part of what we're going to need to invest in addition to continuing to support this nation's family farmers. I don't want greater Minnesota, rural America to decline. And I think we're going to have to step in and be aggressive about this. I introduced a few weeks ago the Small Cities and Towns Investment Act, which is a competitive grant program for small cities and towns specifically. And as we go through each of these packages, I've been asking the question, how are we allocating the state and local assistance? Is it based on population? And are my smaller cities and towns going to be able to have access to it? So it's a great question and one that we're very focused on.
Thank you. Moving back to Nina and maybe Vicki too could answer a question from Brian. Japan has experienced fewer deaths from COVID than Minnesota, even though that country has 22 times the population, 13 times the population density, and an older population. Why has the country experienced fewer deaths than Minnesota?
Thank you for the question. Excellent question. What comes to my mind initially, and Vicki has also some items to share, but as we all know, COVID-19 is new. If we had a tool in a toolbox that we can say, if we do A, B, and C, all will be good. I think we all would be very thankful for that. We're learning, just like the rest of the world is learning, and I think all of us are trying to do the best we can. Specifically, from my perspective, I don't know exactly what has been most successful in Japan. I know most countries, states, and territories have taken different approaches. I will check with our subject matter expert over here when it comes to seeing if she would have additional information to share with all. So I'll turn it over to Vicki.
Well, I honestly have not been watching Japan. I know we were watching China and Italy and Europe and what their responses were, and when people acted and how they responded has made a huge difference in the amount of spread in our communities. And I do believe we had a very good measured approach, using models and using other people's experiences to determine how we were going to keep our places safe. And I don't know what the demographics are in Japan. You said that they have an older population. I don't know if their older population lives in long-term care facilities like we have here. So I guess I can't really answer the question as to what happened in Japan.
Thank you. Staying here, we have a question from John who asks, how can we depoliticize the wearing of masks? Any ideas?
Well, I guess I haven't considered it political because I work in epidemiology and public health. And to me, it's more of a community-focused action that we should all take if we care about the other people in our community, that we are preventing ourselves from spreading something that we may not be aware that we're carrying. And it only makes sense that we would do that when we're in places where we cannot social distance.
Representative Craig, perhaps if you could respond to that same question?
Well, look, this virus doesn't know a political party. This virus, doesn't care, and we can't allow public health to be politicized. And so, I'm not going to do it. I'm going to turn to the professionals and say, what do you think we should be doing? I'm going to follow the CDC guidelines. I'm going to continue to encourage my constituents to do that. And if I see someone wearing a mask, I see it as someone who is caring about their community and wants to protect others. And again, it's frustrating that, even during a pandemic, our political polarization in this country, raises its ugly head. Many of you know that I've co-sponsored over 400 bills so far as a member of Congress, and over 2/3 of them have been bipartisan, supported by Republicans and by Democrats. I've worked with this president when I believed it was the right thing to do, and I've stood up and said, I don't think you're headed in the right direction if I thought it was not in the right direction. And so, look, we got to put politics aside, and that's honestly, in this district, I tell you what I'm so proud of is we've got so many mayors in this district who are coming together and supporting the entire community. I have routine visits with many of the mayors, most of the mayors in this congressional district, and they just want to do right by their first responders, their police departments, their fire departments, their emergency medical folks. I was just down in Red Wing, I guess, a week ago on Saturday to visit with the Red Wing Fire Department. It's the mayors of this district. What they say to me is just do the right thing, and no one cares what political party any of us come from, as long as we do the right thing for this congressional district. And I wish this town that I'm sitting in right now, Washington, was less partisan, was less polarized. I think we'd be a better country for it. And I just, I'd say to everybody out there, let's not politicize. I mean, COVID-19 doesn't know a political party, and we shouldn't either through this public health crisis.
Thank you. We have another question, Goodhue County specific, perhaps for Nina and Vicki. Danny asks, what areas of Goodhue County are spiking with cases at this time? There's been a lot of discussion in forums that this is not a problem in Goodhue County and people are not wearing masks in public in parts of the county. Are individual cities and towns encouraging mask wearing, or is it a county issue?
Well, mask wearing has actually been encouraged from the federal public health system as well as state and county. And we've seen COVID in all areas of our county. And I would say pretty much similarly spread across all of our cities and areas in the county. There's no one area that has a big spike over the rest of them.
Thank you for that. And Nina, did you have something to add?
I'd like to add, I think we have tried to send a clear message for a long time now with our communication, and especially on our social media, on Facebook, and with our partner updates and with our press releases, that face masks make sense. We ask and encourage people to wear it, and I think that is one step that all of us can do when it comes to trying to help our community members, especially those who are the most vulnerable, and truly encourage people to wear a mask. Very important, especially when you're not able to safely social distance.
Thank you for that. And that's going to end our COVID question part of the meeting. So I want to thank you both for joining us tonight and giving us all this great information to have a chance to get it out to the rest of the county. So thank you both. And I will turn to Representative Craig with the next question, which is a non-COVID question. For Angie, Rachel and a few others want to know, will you join Representative McCollum and co-sponsor HR 5598 to protect the Boundary Waters canoe area? We need to protect our crown jewels and permanently prohibit sulfide ore mining.
Well, before I answer that question, and I certainly will answer it, I want to say thank you again to Nina and Vicki. It was so fun to see them dancing back and forth too between the chairs. So great dynamics there. So thank you again to Goodhue County for your leadership. The Boundary Waters is an incredibly special place to me and my family. And I've said from the start that I have serious doubts that any sort of mining can be done safely in that region. And the bill that you're specifically talking about, I wanted to give Secretary Sonny Perdue an opportunity to respond to a letter directly from me that asked him to make public the 20 of the 24-month Forest Service study that was concluded by, stopped by this administration. He has responded to me in the same way that he's responded to every other member who has asked him for that information with no, he's not going to release that information to me. So we will be considering getting on that bill here in the coming months. We've obviously been incredibly focused over the course of the last 10 to 12 weeks with COVID-related legislation, almost exclusively, but I do have serious doubts that that project should or could move forward there in the Boundary Waters.
Thank you. The next question from Mike is, I was happy to see your statement about George Floyd today, saying if we want justice, we must address systemic racism. I was wondering if you could speak to any legislative solutions to police violence or de-escalation training that we could push for or popularize?
Yeah, thank you for that question. I know it's been a particularly difficult day here in Minnesota, and my heart goes out to the family. And yes, I did put out that statement. And what I'm thinking about, is the fact that we do need to address systemic racism in this country. And part of that certainly is related to police enforcement activities and implicit bias or legislation related to additional training. But, the other part of this, and I particularly want to listen to my colleagues on the Congressional Black Caucus. I particularly want to listen and hear from advocates about the various ways in which they believe things need to change. But sadly, this is just one more example or incident. If you look at, COVID-19 even right now, it's leaving dramatic racial disparities from a healthcare perspective. And, COVID didn't create the disparities, but it certainly has laid bare the healthcare disparities we have in this country. We have housing disparities in this country. We have employment disparities in this country. When we look at the 40% unemployment rate right now as a result of COVID-19 in individuals who make $40,000 or less per year, the majority of those are people of color in this country. So I do think that there are a number of things that we do need to look at in this nation. And I'm going to start by listening to what we need to do to move forward, because we have to address this. And the first way to address it is simply acknowledge it and start to listen.
Thank you. The next question is from Joyce. Joyce asks, how does your faith help lead or support you at this time? And how can Minnesotans help you?
Wow, what a great and generous question. Look, I am, I'm just really blessed and blessed to be led at our church at Grace Lutheran in Apple Valley by our new pastor, Deb. She checked in with me just yesterday, as a matter of fact. And I think, for me, this is about what my faith taught me growing up and what my faith now teaches me, and that is to love thy neighbor, to treat people as you want to be treated, to make sure that, you love justice and you walk humbly and you represent everyone. My faith, and many of you know, I am in an interfaith family. I believe that at the end of the day, my faith really guides the work that I do in this Congress to try to make sure that we are creating a level playing field for every single person, because I believe that's what my faith taught me to do, is to love everyone and support everyone.
Thank you. We have got a ton of COVID-related questions, so I'm going to ask you one more. Brian asks, bars and restaurants seem to have been hurt more than some other businesses. Is there any additional help for them other than PPP, or is there any coming?
Yeah, Brian, I couldn't agree with you more. I mean, when we put together PPP, I don't think anyone saw the shutdown and the length that was coming. And so, I have advocated for significant changes to the PPP program, the 8 weeks of forgivable loans extended to 24 weeks. I've advocated the payback period from 2 years to 5 years. I've advocated to have the 75-25 rule that was put on by the Treasury eliminated. I think business owners know best how to spend their money to help them stay in business. The whole goal of this was to be able to keep employees tied to an employer, so that we could keep the economy engine on to stand back up, and we would be in a recession even fewer, a shorter period of time. What I believe over the last several weeks is emerging, and this is after really great conversations with business owners throughout the 2nd Congressional District, but Mayor Kurt Briggs in particular put together an event with some Prior Lake restaurant owners. I actually don't think we've done enough, particularly for our restaurant owners and our retail businesses, because these are the businesses that, we've shut them down. The government has literally shut them down for public health reasons, but they've got rent to make, they've got thin margins to begin with. And so, Brian, I do think that there is a strong possibility that we should come up with some sort of standalone program. I've seen a couple of independent restaurant recommendations here in the last few weeks that have been particularly interesting. There is legislation that's just been introduced in the last 72 hours related to this. And, it's just heartbreaking when you see a business like Charlie's on Pryor with a big for sale sign out front. It's just heartbreaking when you hear about Vivo in Apple Valley already shutting its doors. I was just working with a business recently that was talking about the changes that need to be made to the PPP program, and then I found out that the grill is closing. So, Brian, I think you're absolutely right that more needs to be done, and that it should be done in favor of Main Street and mom and pop shops. It shouldn't be done in favor of large businesses.
Thank you. Another COVID question. Linda asks, can you share with us what you spoke about with Dr. Fauci regarding COVID-19?
Well, I did have an opportunity with a number of my colleagues to talk to Dr. Fauci recently. And, Dr. Fauci, he shoots it straight when he's talking to the American people and when he's talking to members of Congress. And, I think he's optimistic around the testing capacity topic. I personally have believed that the federal government should have played a much stronger role in testing capacity early on. And in particular, we are still having some problems making sure that we get the supplies necessary to conduct this testing. So, I think Dr. Fauci continues to warn us that we are in the early innings of this, if this were a baseball game. And so, I don't want to throw a wet blanket on optimism, because I certainly want to be optimistic that America's going to be able to find a vaccine or therapeutics in a timely manner. But I think he's rational, he's reasonable, and he wants us to understand that we could be in for a bit longer slog than we'd all like to see. And I think what that creates for this Congress, Linda, is a set of very difficult policy choices. We've never been here before in modern history. And, as we think about, the depression that we do have experience from, this is such a sudden cliff where we have gone from, unemployment, where the biggest challenge for our local businesses was to find the right work skills, for the jobs that exist to how do we rethink our economy when this is all said and done. So, very challenging, but I know if there's any folks who can get through it, it's certainly the American people and Minnesotans in particular.
We've come to our last question. Sue asks, how will you support vote by mail for people all over the country? How will you support and ensure the safety of poll workers on Election Day?
Well, Sue, that is a great question. And, I would point you to the HEROES Act as sort of a marker bill. It wasn't a perfect bill. I probably haven't voted for a perfect bill since I've been a member of Congress. But what was in that bill, in addition to support for our cities and our towns in our state, what was in it, in addition to some of the changes to the Paycheck Protection Program, was $3.6 billion for vote by mail, and a specific requirement that every state have at least 15 days of vote by mail. And so, I think in Minnesota, we're lucky we have no excuse absentee balloting. We've seen a rise in Minnesotans who vote by mail just in general over the last 2 or 3 cycles. And so there will continue to be a very robust discussion about vote by mail, especially for those Americans who have pre-existing conditions, for those Americans who may be more at risk for COVID-19. It's also important that we do have polling stations, but the truth is we need to make sure that we have enough so that we don't have Wisconsin happening all over again in Minnesota. Don't be like Wisconsin, Minnesota, and that we have enough polling stations, but we also have enough personal protective equipment, and that we have enough time, which means we are starting now to recruit those poll workers who are less at risk from dying, quite frankly, of COVID-19. So, it's a great question. It's an important question. I have asked for data on vote by mail, and no matter where I look, the studies show that vote by mail is a very effective way to vote. I've seen Republican governors use it. I've seen Democratic governors use it, and I would say that this is another one of those things where, we shouldn't let political polarization enter into the discussion. Now, we all know vote by mail is safe. The president votes by mail, and we should move forward to make sure that the safety and health of Minnesotans is our top priority here in 2020 in the election.
Thank you. And thank you to everyone out there for so much for joining us this evening. I've enjoyed being the moderator. Any chance I get to represent the city of Zumbrota on a little bigger stage, I'm grateful for. So with that, I'm going to turn it over to Representative Craig for your closing remarks.
Well, Mayor, thank you so much for moderating just a great virtual event this evening. The silver lining of a virtual town hall is that I'm in DC and I could still move forward with it. I am hopeful that at some point soon we will all be back together. But as always, I'm incredibly grateful for your continued input. I'm grateful for all of the work that you're doing in your own communities. I know throughout this congressional district, Goodhue County, thank you so much for leading this discussion on public health and what you're doing specifically. I think it's important that we highlight the rural areas of this country, the suburban areas of this country as well. Many of you know that I've been fighting to make sure that in future COVID-related bills, we have smaller communities gain access to the resources that they need, because COVID-19, as you can clearly see and have heard tonight, it doesn't know boundaries geographically or otherwise. So again, in the 17th Town Hall this evening, I just want to thank each of you for being such great members of the community. And it's really an honor to serve you. And thank you so much for all that each of you do. Have a great evening.